What if you have a tight aortic valve and you don't qualify for surgery, or the surgery would be too risky for you and the open heart surgery is just not an option for you? This is something that we do in the structural heart program called TAVR. TAVR stands for aortic valve replacement, but the T in the front of it stands for transcatheter, meaning we go in through your leg like a cardiac catheterization and we replace your valve through a catheter. And I'll put a nice animation up here. Basically, some people have a aortic valve that gets tighter and tighter and tighter and tighter over the years, to the point where they're almost going into heart failure, or they are in heart failure now. They're out of breath, they can't do what they used to do, they're super fatigued, they don't get out of bed anymore, they are exhausted because of this tighter valve. You sometimes don't even realize you're limiting yourself because it happens insidiously and it comes on slowly and you don't even realize that you are limiting yourself. So this procedure, we go in through your leg, and obviously we take beautiful pictures. We have the fluoro going, we have the ultrasound going, we have multiple different ways. We position the valve in the old aortic valve and we blow it up with a balloon, and that takes over the area of the old valve, and now you have a brand new valve inside of your old valve. The old valve gets pushed away to the sides and this new valve takes over. This has been a procedure now that has been going on since the year about 2010, 2011 or so. Started out with the partner trial, and we've been a center of excellence in doing these since about 2014 or 15 or so, when we first started doing them. We have a fantastic, amazing team in the structural heart program, where our cardiologist, our structural cardiologist, will see you. We'll get all the measurements. We may need to do a heart cath before and a CT scan and a couple other imaging modalities to make sure you're right fit for the program. Normally, obviously, open heart surgery would be the best option, but some people are not a candidate for open heart surgery and would never survive the surgery, or just may not want it. If you are a candidate for this transcatheter aortic valve replacement, then this is a beautiful and convenient, very low risk procedure where you do not need to stay in the hospital for 3 to 5 days or a week or however much it may be after open heart surgery. You would just be in there for a day or two, and maybe sometimes less, but usually around a day or two, and then hopefully you can get out of the hospital and do really well. We've had amazing outcomes with this, where people are back to doing things that they love. They're doing things with their grandkids. They're back to walking again, going out, going to bingo, or going to the gym, whatever it might be. This is an option for some people, and I highly recommend you bring that up next time with your cardiologist at Toledo Cardiology. We'll be more than happy to discuss this with you and see if you're a candidate for this and if this is the right procedure for you.